The first time that I meet someone that comes to my clinic, it's normally not to give a diagnosis of dementia. So the first encounter is probably, as you said, after the GP has referred the person. So what I do myself, and I tell my students and junior doctors to do, is to spend a fair amount of time at the beginning to set the scene. So to make the person feel comfortable with the consultation, as you said, sometimes people are a bit weary or scared to come to the psychiatrist. So to explain why they've come to this specific clinic and to gather a sense of how much they agree with them having a problem or not, or a worry about their memory problems, if that's the case, and then start a kind of no contract, but a dialogue from the beginning to, as I said, to set the scene, but also to explain what to expect afterwards. So, for example, I would typically, once I've cleared, and I'm also clear myself that they understand why they're in the clinic, then I explain what we're going to do in the next hour or so. Okay? Sometimes for the first time you meet someone, you need a lot of time. And the reason for that is because you want to get to know them. You want to give them enough time and space to explain what the worries are, and also obviously doing all the tests that you need to do. So the first thing for me to say is, you're going to be with me for 45 minutes or an hour, and in that time I want to do all these things. I'm going to ask a lot of questions. So if there's any time that you feel uncomfortable, just let me know, we can pause. But it is setting the scene, and also from the beginning to say, whatever I discover through my assessment and any investigations that I might do, I will share with you. Are you happy with that? And I think from the beginning, if you put the expectations that whatever you find out about their condition, you're going to share with them, I think that helps a lot in the relationship that you're going to have with that person.